myself and Barry will be delivering this webinar as well again today. So I'll let Barry introduce himself first.
Hi everybody, my name is Barry Deehan and I'm a Youth Health Promotion Officer with Mira in the Sexual Health Centre.
And my name is Nora O'Farrell and I am the other Youth Health Promotion Officer. We give a fun fact about ourselves every week. So I suppose this week's fun fact about myself and Barry is that we are continuing to save currently, as we have a bad habit of accumulating parking tickets since we started in the Sexual Health Centre. So it's been plus on the side of COVID that we are managing to keep our bank balances topped up recently.
And I'm sure the personal manager is happy too.
Yes. Poor City Council revenue is down. So that's just a fun fact, so you feel like you know us a little bit better. Just to say as well this week as we begin that I want to draw your attention to the sexual health hubs. I don't know if anybody's seen any of the advertisements that have been going out around this and some of the media coverage that we've gotten, but on the 23rd of September we officially launched Ireland's first sexual health hub here in Cork with Youth Work Ireland and Joe Curtin. I don't know if he's on the webinar, but it was a great partnership. And what it is it's a stand that brings sexual health directly to the youth of local communities. So all of the topics that we're covering in this webinar series, it has leaflets on STIs, contraception, relationships, puberty, things that people go through, LGBTI plus supports. And it's really just a way of making sure that youth can be linked in with all of their sexual health needs, no matter where they are, city and county. So what we're hoping to do is set up hubs in all different organisations. So if there's anybody on the webinar here who'd like to set up a hub in their local community and get involved, please drop us an email. You'll see on the right hand side of the screen there as well, education@sexualhealthcentre.com is the email, and we will work with setting up those anywhere that people are interested. So the more of them that we can get out there, the better, and the more accessible that we can make sexual health for young people. Also, just to note, our session 1, relationships, consent and pornography, is now available to stream on YouTube. So if anybody is interested in looking at that, just type Sexual Health Centre and Screen Age Kicks into YouTube and it should pop up there for you. But if you've missed it or if you just want to recap, it's a really handy way just of seeing everything that we covered in that session. So just to run through as well today's program schedule. So today, contraception, STIs. We are going to start first with me. I'm going to do a little fact or fiction on pregnancy. So just some of the questions and the things that we hear from young people on a regular basis. Just, you know, what are they? Are they true? So that you're willing and able to answer them. We'll go through the different types of contraception, so the barrier forms and the hormonal forms, just so that everybody is aware of the types of contraception that are out there and that they're able to answer questions or signpost to GPs if people are looking for those. And all of the services and supports that exist where young people can actually access this type of contraception. Barry will talk through sexually transmitted infections, STIs, and again, we'll have a Q&A at the end if anybody has any questions that they would like to ask. Again, if anything pops into your head during the webinar, if you want to pop it into the chat box, we'll answer them at the end, but it can often just be handy to write that question while it's fresh in your head, so don't be afraid to send those in either. So without further ado, I suppose we will begin. So just to have a little think, I suppose, about when it comes to contraception, STIs, and sexual health information in general, where do young people go to access this information and where are they getting it from? Is it accurate? Are they sure of the information that they receive? And recent research conducted in 2019 looked at the barriers to sexual health information for young people. And what we are really aware of, and I suppose, again, the virtual world that we're living in, that we're discussing, is that young people are going online to look for a lot of this information because they mightn't be receiving it in school or they could be too embarrassed to ask parents or friends. And there are some complications in terms of this. So when we think about where do young people get their knowledge, this research has shown us that many young people are still reporting difficulties in finding accurate information and details on their local services and exactly what they need. So things that they reported were fear of being discovered while searching for information on sexual health online, fear of inadvertently bringing up pornography rather than sexual health information. So we know that when young people often type in sexual health words or body parts, it can inadvertently bring up types of pornography or things that they're not looking for at all. And that's a huge problem in terms of online searching. Sexual health information sites are also considered to be too text heavy. So a lot of the sexual health sites that are out there are very medical based or, you know, text and fact heavy. So you get a lot of font in very heavy language, I suppose. There's no kind of bringing it down to their level or discussing the slang or the terms that they use and actually sharing that and using visuals and graphics to really convey a simpler message. So a lot of the time they're turned off by these really just text heavy sites, and the language can be quite difficult. So again, while myself and Barry are going to use the correct knowledge and terminology for different body parts and sexual health terms, when we're delivering workshops or working with young people, we do make a point of actually getting their information from them in terms of what kind of language they use, what do they refer to things as, and really then connect the two for them. And that makes it much more accessible and memorable for them. So in being, I suppose, aware of all of this, that they do struggle and that it is quite hard for them to find information, we, when we are delivering the workshops, use things like this card here when we're discussing sexual health. And what these are almost like a fact or fiction or myth buster cards. So we've put together some of the most common myths or facts that exist around sexual health that young people might not be aware of. And there's always different stories, or so-and-so told me that that's definitely true, but people aren't sure if it actually is. And often we mightn't be sure ourselves as professionals when we're faced with answering these questions. So I'm just going to go through some of the most popular ones, bust some myths maybe for some people, and just offer some information to others that if you ever do come up against these, or you hear young people talking about them, that you feel that you are equipped to answer them and potentially shed some light on these areas. So if we look at the first one, is it possible to get pregnant the first time someone has sex? And this is something that there can be a lot of back and forth on, surprisingly, and people are like, absolutely not, sure, you get a free go the first time. And we all know that's not true. So yes, it absolutely is possible to get pregnant the first time somebody has sex. And we will often point out to young people actually that they are extremely fertile. So the younger they are, the more likely they are to get pregnant sometimes, because their bodies are primed and ready to go. So it's really important that we bust that myth and that anyone can get pregnant at any time that they choose to have sex. Is withdrawing the penis before ejaculation a safe way to avoid pregnancy? So this is one that always comes up in workshops as well, and when we're working with people, and it's this idea that if I pull out, I can't get somebody pregnant, or that I think it was back in the day, you know, the church suggested that this might have been a good method in terms of prevention as well. But really, this is something that still is going around nowadays that we come up against a lot, which is, oh, but sure, I pull out, I don't need to use a condom, I don't need to worry about contraception, because if I don't ejaculate inside my partner, then there's no risk of pregnancy. So when we come up or we hear these type of things from young people, we make a point of going through, I suppose, the facts behind it and how the body works. We will explain things like the minute a man gets an erection, there is pre-cum on the tip of the penis, which is like a clear fluid. We'll explain that this is a cleaning fluid. So if we think about a man's penis, he has one tube which he urinates out of and ejaculates out of. And in order to keep this clean and make sure that, you know, safe or sex is safe, this cleaning fluid essentially is sent up through it, and there's thousands of sperm inside this. So from the minute a man gets an erection, there's thousands of sperm sitting on the top of the penis. So before he ever needs to ejaculate into a partner, there is a risk of pregnancy. And these can be shocking for young people, but unless we talk about these things with them, or somebody is comfortable bringing up these subjects and explaining it, because it is biological, it is normal, these are natural bodily functions, how do we expect them to know? And this myth, you know, has been going around for years. I'm sure a lot of people have heard it. So actually knowing that, no, it's not safe to pull out, and this is why, can be really enlightening for them. And we're much more likely to find that young people are accessing and willing to use condoms as a result. So there we go. No, it is not. And the reason being, there is semen in pre-cum. Can a girl get pregnant if she has sex during her period? So this is one, sometimes when we use it, we get a lot of kind of, I don't know, oh my God, I'm so grossed out reactions, or, oh, that's disgusting. And I think it's really important to note as well for, you know, the groups that you're working with, or if you ever come across these type of topics, that actually sex is a very personal choice, and the types of sex that people choose to engage in is personal to them, and it's their own preferences. And therefore nothing is wrong if that is something that somebody enjoys. So we will always start with that, I suppose, that, you know, there isn't anything wrong with having sex on somebody's period if that's something that they choose to do, but that it's important people are educated and aware of the facts around this. So can a girl get pregnant if she has sex during her period? Yes, is the answer. And the reason for this is, if we think about it in terms of how we would explain this to a younger person, simplifying it, we always use the example of twins. So if we think of identical twins, what that is that a woman released an egg and that egg split into two, and you get 2 exact copies of that one egg that she released that month. If we think of non-identical twins, though, it means that for some reason that month, that woman released 2 eggs. Now, a woman has 2 ovaries, so she could have released the 2 eggs from one of her ovaries, or she could have released them from both. But we don't know the reason why. But what it is they're 2 completely separate people, because they're 2 completely separate eggs, and therefore this is an anomaly. So when we think of a girl having sex on her period, it means she might be flushing out the egg that she released earlier in the month, but during her period, her ovary could randomly decide to produce an egg, which means that she could get pregnant. So I suppose the point with these things is there are potentially, you know, times that people think are safer to have sex, but there is never a particularly safe time in terms of this, because there is always the chance of a rogue egg. So it's just important that people know this. So we always use that non-identical twins example just to kind of bring it home to them. The next one then is baby oil and Vaseline okay to use as lubricants with latex condoms. So this is a big one that always comes up. So people will often, you know, talk about when they're using condoms, oh, sure, I just ran to the bathroom and I grabbed the first thing in the cabinet. And often in houses, people have baby oil or Vaseline for different purposes, and that they grab these because they're easy and accessible. So it's really important that we explain to young people with latex condoms, baby oil and Vaseline is not okay to use. And the reason for this is that the actual baby oil and the Vaseline will break down and kind of erode the latex in the condom. So if somebody is using a condom, it's really important that they get the correct water-based lubricants. So when we give out condoms in the centre, we always give the water-based lubricant with it for this reason, so that somebody is safe and that they don't have an accident. And in doing so, if somebody was to use, say, baby oil or Vaseline and starts to erode the condom, it means that it's more likely to break or tear. And if it breaks or tears, you have a risk of an STI or a pregnancy. So all of these kind of lead through in terms of when you're talking about these issues with young people. How many times can you take the emergency contraception pill? So this is another one that comes up a lot, and we get a whole range of answers for this. So a lot of times we hear things like, oh, just once, or you can take it 6 times in your lifetime, or you can take it once every 6 months. It depends where we go, we get all different versions of it. And I suppose the first thing that we always note for people is that the emergency contraceptive pill used to be called the morning after pill. So a lot of people might be more familiar with that name for it. And they changed the name because the morning after pill gave the kind of wrong idea that you could only take it the morning after you had an unprotected experience. So the emergency contraceptive pill was to try to change that it would be something that you would take in an emergency if you accidentally had a condom break or had a risk where you had sex without any form of contraception and you thought that there was a chance you might get pregnant. So you can take it as many times as required. So it's really important that young people are aware of this, that there isn't a limit on when they can take it, but there are some guidelines around it. And I suppose the hint is in the name. So emergency contraceptive pill should only be used as a form of contraception in an emergency. So when they go to the pharmacist, because you can get it over the counter, it wouldn't be good if somebody was going every Saturday to get the emergency contraceptive pill. One, it could be quite expensive because there is a cost for it if you don't have a medical card, but also it can be quite tough on the body. So the hint is in the name, I suppose. It's an emergency for kind of, you know, when you need it. But if somebody was presenting on a much more regular basis, the pharmacist would probably have a conversation with them around using condoms or a more regular form of contraception to protect against pregnancy. But obviously there's still a risk of STIs, which Barry will be talking about later. So that would be also something that would be in need of discussion with them. It's important to note, I suppose, the emergency contraceptive pill is free with a medical card. So for young people, if they have a medical card, they can just go to the pharmacy and get the emergency contraceptive pill. And if they have to go and buy it, the price can vary hugely across pharmacies. So places like Boots, we have heard, is much more expensive than perhaps a local pharmacy. But again, it's really important that they can be supported in accessing that and know about it, know how many times, know where, know how, know their rights around it. So emergency contraceptive pill as many times as required, but the hint is in the name, in emergencies only. So that's the kind of main questions that come up just in terms of different areas of contraception and how conception happens, I suppose. But when we think of accessing contraception, there are still some huge barriers for young people in actually being able to do that. So the working group released a report in 2019 on access to contraception for younger people. And what they found was that 18 to 25-year-olds were much more likely to experience difficulty in accessing contraception. And the main barriers they reported were lack of local access. So depending on where they lived, they found it much harder to actually find somewhere to get contraception. The cost, so cost of contraception can be a huge barrier for people depending on whether they have a medical card or not. Embarrassment. So again, for a younger person, actually going and admitting that you need contraception, asking about the different types and being aware of what's available for you can be quite embarrassing if you're not sure who to talk to or you're quite alone in that. It can be inconvenience. So if somebody is used to doing everything online, or they're in the heat of the moment with somebody, for example, and they've been out on a night out, often it's an inconvenience to think about contraception, or they can be embarrassed again to actually ask about using contraception with a partner, so they often don't. And there's a lack of knowledge in general about where to access contraceptives. So what we're hoping to achieve here on the webinar today is an overarching kind of knowledge of the types of contraception that exist, the barriers that exist for young people, and then the supports and where they can go to actually access this. So kind of trying to address, I suppose, the points that have come up in these research pieces recently. So what can we do? I suppose what we need to do as professionals is start to remove the barriers. So we need to talk to them about contraception. We need to be open to actually having those conversations, educating ourselves on what exists, and then bringing it up in conversation, because it is quite a normal thing, and it's very important that young people know about the different types that exist and know where to access it. We can give them all of the information on those options then, so that they can make informed decisions and decide what might suit them best if they need it, and tell them where and how they can access contraception, so that we demystify it and really make it as accessible as possible for them. So there are two different forms of contraception, I suppose, is the main thing to know about it. So we have what we call barrier forms of contraception, and they protect against pregnancy and STIs. So one of the most common forms of barrier methods that everyone will probably be aware of is condoms. So condoms are 98% effective when used correctly, 82% when not always. So there is a right way and a wrong way to use a condom, which myself and Barry always go through in the workshops. And I suppose condoms are a thin sheet that is rolled onto the penis, and it creates a barrier to prevent the sperm from actually entering the vagina and therefore getting somebody pregnant. There are different types of condoms. So often we talk about condoms and everyone thinks of the generic types, but it's really important as well to think about informing young people on flavored condoms. So flavored condoms have a completely different purpose, and I suppose they were designed for oral sex. So we often come up in workshops of young people using flavored condoms for regular penetrative sex, and it's actually a risk. So they're made from thinner latex, and they're much more likely than as a result of rip or tear, because they weren't designed to be used for that purpose. Now, the warnings are always on the boxes, but as we're well aware, young people are unlikely to read the instructions and they don't go through it line by line. So as professionals, we can talk to them about this, that, you know, the hint is in the flavor. You don't need a strawberry condom to have regular penetrative sex. The idea is that it's for oral sex. There is a risk that it will rip or tear with penetrative sex, and regular condoms are there for that purpose. I'm going to show you the condom video that we have designed. It's an animation that we use with young people just to teach them about how to use condoms in a second. In the workshops, myself and Barry would actually do a condom demo in person with them, so that they're, you know, educated and they can have a go themselves about how they would do it. And it's, you know, kind of fun and interactive. And I think it's really important that they get a chance to practice this, because as we always say to them, the first time they use a condom shouldn't be the first time they're going to use it in the heat of the moment, because it can be quite stressful. They should have practiced, they should be familiar with it, and they should know how in advance. And the best way to do that is having a bit of fun in a workshop and actually everyone doing it together, and having somebody to kind of roadmap that for you and show you how to do it properly. Female condoms then, I suppose, are the next type. So these aren't as common and they can be quite expensive. I think we looked them up and they were about 15 to 17 euros for a condom, but they do exist and some people do choose to use them. So it's important they know they're there. It's basically like a condom for the penis, but for inside the vagina, and it's the same thing. It's 95% effective, and it is placed carefully inside, and again creates a barrier to stop the sperm from actually entering the vagina. They're disposed of after one use like a condom as well, so it can be quite expensive for a young person to afford this. But again, it's important in case anyone comes across these, that they're aware that they exist and they know what it is. The other form of barrier then that can be used in terms of safe sex is a dental dam. So what a dental dam is basically a thin sheet of latex, and it is placed across the part of the body that somebody wants to stimulate, and it's mainly used to prevent against STI transmission. So if somebody is stimulating the vagina or the anal area, they can place the latex across that area to prevent against the share of skin-to-skin contact. Dental dams, again, can be expensive. They can be flavored. They are available to buy, so they are available in Boots, but we'll explain to young people that you can actually make your own dental dam as well, just by cutting up the condom and spreading it out into a thin sheet. So, you know, there's ways around these things, but as long as we know that and we can inform that to young people, we give them the best chance possible to protect themselves. So we're just going to have a quick look at the condom animation that we have that we would use with young people to give them an idea of how to correctly use a condom.
There's no sound in it, word, eh?
You've no sound?
No, there's no sound in the video.
Okay, sorry. It's playing on my side. I don't know why the sound isn't playing for everybody. That video, again, is available online. I suppose the easiest way to watch it is just to put it in the Sexual Health Hub condom demo video into YouTube, and it will play for you there. And what it basically is, I suppose, if I can talk you through it a little bit, is just the idea of making sure that young people know how to be safe when they're having sex. So it covers everything from unwrapping the condom to looking for the date, explaining to them that, you know, there are certain factors that will actually affect the condom. So heat, light, and damp can change the effectiveness of the condom. So keeping it in a pocket or in a windowsill can be damaging to it. Also, that there are serrated edges on every condom. So they're designed to be easily opened, and you open them on the serrated edges. Watch out for nails and rings because they can puncture the condom, and that the condom is pinched at the top and then rolled down to the base of the penis to make sure that it's on correctly. So you can see the roll as well as on the outside. Again, as we were discussing earlier, only water-based lubricants should be used with condoms, never anything oil-based. So Vaseline and baby oil will actually rot the condom and can cause it to break or tear. The penis should be withdrawn immediately after ejaculation, and it should be held away from the partner, and then the condom tied with a knot in the top to prevent it from leaking, and that there isn't any sperm getting anywhere near the vagina. The condom then, you can check it, see if there's any rips or tears, wrap it in tissue paper and put it in the bin. We always advise young people never flush it down the toilet because it seems to be one of those things that they go to. So we tell them the horror stories of one, it can often block up plumbing, and also they have a really nasty habit of reappearing. So condoms prevent against STIs and pregnancy, so they're a very good form of contraception, and it's really important that young people are educated on how to use them properly. So again, I'm really sorry that the audio didn't work on that, but you can look it up on our YouTube channel. Just to have a quick look then at our hormonal forms of contraception. So these are mainly for females, and they only protect against pregnancy. So it's really important that people are aware of that condoms and barrier methods can prevent against STIs and pregnancy, but these only prevent against pregnancy. So some of the most common ones, again, that I'm sure you'll have heard of, but just to give it an overview and a recap so that people are aware and can kind of signpost. For these types of contraception, it's really important that young people go see their GP. So we'll always advise that. So we'll educate them on just the types that exist so that they're aware, but it's really important that they actually go to a GP to find out what's the best type for them and get a prescription then around that. So the pill, a lot of people will see the pill packets and kind of are aware of these. They're 99% effective when used correctly, but 91% when not used. So what they are basically is a hormone that a girl takes every day, and it prevents her from ovulating, so releasing an egg. And therefore, if you don't release an egg, there's nothing there to actually fertilize, so you can't get pregnant. We always advise people, it's really important with the pill to remember that they're only good if you're really good at remembering to take something every day at roughly the same time. So you need to be somebody who's quite organized and good at that type of thing. Also, things like antibiotics and vomiting can reduce its effectiveness. So if somebody, you know, gets a cold or a flu and they're on an antibiotic, it's advised that they use a condom for 7 days. So just little things like that that they're aware of and that they know. With the patch then, the patch can be a very good equivalent to the pill for people. So again, 99% effective when used correctly. It's basically like a little plaster that they can place on their body, and it releases the hormone in through the skin. So again, prevents ovulation, so therefore you can't get pregnant. You wear a patch for a full week, then you take it off and you wear another one. You wear them for 3 weeks out of the month. So for somebody who's less good at remembering to take something every day, this can be a great alternative because they only have to remember to change it once a week. And again, they can place it discreetly on their body where they mightn't even notice it. It should not be placed on the breasts or anywhere above the neck. So that's really the catch with the patch. Very catchy. The implant then, or the bar as it's more commonly known, is a slightly more longer term type of contraceptive. So this can last 3 to 5 years, and it's a small flexible rod. It's about the size of a matchstick, and it's placed under the skin just inside the upper arm. So it can be felt under the skin if you kind of rub for it, but it cannot be seen. And what this does then is the rod has all of the contraceptive hormone in it, and it slowly releases that into the body. So this is what we call a longer term contraceptive. So because it's 3 to 5 years, this would be a good choice for somebody who it isn't their first type of contraceptive, but maybe they're in a long-term relationship and they know they're going to be having regular sex and they just don't want to have to be thinking about taking contraceptives. So again, they can go to their GP, and this could be something that they could be advised would be suitable. And the other one that we're seeing a lot more of as well in younger people is the IUD, or the coil. So what it is it's a small T-shaped plastic frame, and some of them are made out of copper, and they're actually placed inside the womb, as you can see on the right. That's what it would look like inside. And they work in one of 3 ways. So they stop the sperm from reaching and combining with an egg, they prevent or delay the egg getting into the womb, and they prevent the egg from settling in the womb. And the copper ones then are toxic to both sperm and the egg. So these are a very effective method of contraception. They're 99%, and they are much longer term. So a lot of these will be a 10-year contraceptive. So previously they had been very popular with people when they were finished having their families, that maybe they'd had all of their children, but they were still sexually active and they wanted to, not worry about getting pregnant again. So they would get this put in. A lot of younger people are getting them nowadays and they find them great. So it's something that you might hear more of or come across. So just to be aware that they do exist. And again, it's something that is out there for people if they don't want to have to worry about contraception, that these are their options. Now, there are more than the ones that I've discussed today. So there are other types. These are just some of the ones that we come across most commonly and the people ask us about. So it's just to give you a rough idea of what they do and where they are. And again, we would always be signposting somebody to a GP or a contraception clinic around these, so we can give the basic information and talk to them about what might suit, but a GP is in the best position to actually prescribe. So when somebody thinks then about, wanting or needing contraception, and they might come to you, there are some important things, I suppose, to know as a professional, because access and cost of contraception is a huge barrier and is one of the things that we really have to try to figure out. So if we just have a look at actually having to pay for contraception, so it can be expensive. So an average packet of condoms would cost around 13 euros. So 12 condoms, 13 euros, almost €1 go. And we're hoping and assuming that they use it correctly, because if they make a mistake, myself and Barry would always recommend that they bin it. So if somebody was having to pay for this, it would be quite an expensive way to go about it. Equally, the cost of an oral contraceptive pill, so the pill is about 5 to 14 euros a pack. And if they had to go to their GP for consultation and prescription, that's about 50 euros, probably twice a year, so that they can get a checkup and get it done again. So things then like the longer acting ones, so the bar and the IUD that I showed you, would be about 250 to 350, including cost of fitting and consultation. So that's a huge expense for a young person. And often these are the kind of things that we hear about. People are like, oh, sure, that's too expensive, I'll just take the risk. So what we will always talk to them about is, if you have a medical card, and 1/3 of the population actually hold a medical card, they can access contraception, including the bar, free of charge, except for the €2 prescription levied at the pharmacy. So that's huge for people. So it means the contraception is much more accessible. Condoms and the coil are not covered under these schemes, but in the likes of the Sexual Health Centre, we give out free condoms and lube, so young people can come and actually access free condoms on a regular basis. And if anybody wants to sign up for a hub stand, with the hub stand, we give condoms and lube, so young people can actually access that in their local communities and areas. So again, it's a really good way of getting contraception out there and making it accessible. So in terms of services then, the Youth Health Service is unique to Cork, and it's really important one to keep in mind around contraception for young people. So they have a free STI clinic and a free contraceptive clinic, and that is a GP-led clinic. So a young person can go to the Youth Health Service, make an appointment, talk about their contraceptive options, and actually go about getting contraceptives there. Most of the service is free. I think there is a small charge for things like the bar and the IUD, but again, it's a great service and really important. So you can Google them, it's the Youth Health Service, or their phone numbers are there below, and yhs@hse.ie if you want to drop them an email. But it's a really handy signpost for young people. At the Sexual Health Centre, again, as I said, we offer any kind of advice, and we will signpost and link young people or yourselves as professionals with any services that are applicable. We also give out free condoms and lube. We do free pregnancy testing in the centre. So if anybody or their partner is worried that they might be pregnant, they can access a free pregnancy test, and again, free pregnancy counselling and support around that. So again, all of our details are below. I'm sure you have them from before, but if you ever need us, just type us into the website or the web, and all of our details will come up, and you can drop us an email. So that is an overview of contraception for today. I'm going to pass you over to Barry to talk about STIs, and if you need to ask any questions or if you want to pop anything into the chat box, we will answer them, as I said, at the end. Thank you very much.
Thanks very much, Mara. I've just changed over to so that you're the host at the moment. So the chat function will work on your side. Lots of information there, great overview of what's happening in the community with the whole project, and lots of information there on contraceptives, along with our final points on sexual health services accessible to young people, which leads us nicely into the second half of today's webinar. So I'm going to share my screen here. So the second part of today's webinar is focused on talking to young people about sexually transmitted infections. So we'll look at what STIs are and the prevalence of STIs amongst young people in Ireland. And I'll also provide you with an insight into our workshops and the workshop experience, with the odd pop question just to keep you on your toes. So we'll move on. STIs. In this section, we'll have a look at what sexually transmitted infections are, STIs among young people, as I said, and the workshop experience. And today I learned that there's more to STIs than meet the eye. So what are STIs? STIs are infections that are transmitted through sexual contact, and I suppose sexually transmitted infections are passed on from one person to another during sexual contact, and bacterial, viral, and parasite-like infections are most common. And common symptoms are discharge, pain, swelling, spotting, irritation, rashes on skin, sore patches, and lumps. And I suppose sexually transmitted infections are not a consequence, they're an inevitable part of sexual activity. As we mentioned in the last episode, yeah, sexual health is an intricate part of one's overall health. So, and I suppose traditionally STIs have been viewed as a consequential factor of deviant behaviour as such, but alas, they're inevitable as part of sexual activity, as I say. So, quick question here for everybody, and I suppose again it's not looking for answers, just about getting you thinking, and these are the kind of questions that we do get in workshops, and these are the kind of materials and that we show young people to get them involved in conversation and get discussions going. So can you get an STI from oral sex? Yes, you can. But chlamydia, herpes, gonorrhea, syphilis, and HPV can all be transmitted orally. And oral sex is the use of the mouth, lips, or tongue to stimulate the clitoris, penis, or anus. So again, the content of the question and answer here is the kind of information that we do explore with young people, and it's the kind of conversations that do come up. So again, it is about providing young people with the STI information, and like I'm not going to go into the ins and outs of every STI that's out there today. It's more about what we do introduce young people to in the workshops and how we respond to them in the workshops. So we'll have a look at STIs in young people. So there has been an upsurge in sexually transmitted infections, particularly among those 15 to 24 years, according to the Health Protection Surveillance Centre. Adolescents' age at first intercourse has also decreased. So the low uptake of STI screening among young people is a major public health concern, and research has shown that the lack of education and long waiting times in clinics are some of the biggest contributing factors to young people carrying STIs. And I suppose with the COVID lockdown and all the changes that have come in with COVID-19 over the last couple of months, again, the STI screening services have been reduced dramatically. So again, it's about young people not having access to the services that they need. What I have here is a chart from the Health Protection Surveillance Centre, and it's just to give you an overview of sexually transmitted infections in young people at the moment. And these figures are taken from the 27th of September this year to the 3rd of October this year, so only last week. So we can see here the three age groups of 0 to 14, 15 to 19, and 20 to 24 years. And I suppose the 15 to 24 year age group is the group that myself and Wera tend to work with the most. And if we take a close look, as we can see, the 15 to 19-year-olds, the weekly total between the 27th of September and the 3rd of October has been 22 notified and recorded STIs in young people between those ages. And again, 78 between the 20 to 24 age group, and that's the weekly total. So in contrast to this as well, we also have the cumulative total this year, which gives us an overview of the year to date. So in the last 40 weeks, the total number of STIs recorded amongst 15 to 19-year-olds has been 712, and amongst 20 to 24-year-olds, just over 2,500. Again, our objectives within workshops and providing sexual health education to young people is about keeping the 15 to 19-year-old total numbers down to what they are, rather than them creeping into the 20 to 24 age group, and those numbers increasing again. So just to give you a little comparative there as well, in terms of the figures that you see in front of you, the weekly figure is from week 40, and the week before, week 39, there was 15 cases amongst 15 to 19-year-olds, and this is across all types of STIs. And then we have 68 in comparison to the 78. And in the total this year, it was 690 the previous week and 2,520 the previous week across the board. Okay, these statistics are available from the Health Protection Surveillance Centre website, and they report these figures on a weekly basis, and they also provide, I suppose, our annual report as well. And the truth of the matter is that 1 in 2 sexually active young people will get an STI by the age of 25, and most won't even know it, unfortunately. So to give you a little insight into the figures that were reported between 2017 and 2018, we have chlamydia in young people making up 49% of cases reported. We have gonorrhea in young people making up 32% of cases reported, and genital herpes in young people making up 39% of cases reported throughout 2017 to 2018. And again, notifying a 3% increase compared to 2017 and 2018, where we can see a rise in chlamydia, a drop in gonorrhea, and a rise in genital herpes, giving us a percentage change of 3% in total. And sorry, and this is the distribution by sex then as well. So you can see the variances between the male and female population as well. And I suppose if we go back to the first shot here, as I say, 0 to 14 years age group here as well, which some of you may have noticed. And this is a category where, unfortunately, cases can be resulting from non-sexual contact or sexual contact in the event of abuse or assault. But more often than not, like these figures here, as the 1 this week and 16 throughout the year, can be from accidental incidents. So again, non-sexual contact with another individual, from a mother to an infant during birth or breastfeeding, and in some instances from towels or other objects that come into contact with exposed skin or genitalia. Okay, so those explain the 0 to 14-year-old group. And just we have a few links here on the data and resources used to collect that data. So as I said, the HPSC website has the recordings of each weekly total of STIs confirmed and reported. And unfortunately, despite social distancing recommendations, STI transmission continues to grow. Mira noted earlier the number of barriers surrounding young people accessing sexual health services and information due to lack of knowledge of where to turn, who to talk to, afraid to look online for fear of browser history and inadvertently accessing explicit materials. And since the arrival of COVID-19, as I said a while ago, screening service provision has reduced dramatically. So are we seeing the true numbers here as well in these reports if young people aren't attending their medical appointments and looking after their sexual health by getting tested regularly? Another barrier present can be massive fear of being judged or reprimanded for needing these services, considering recommendations and restrictions surrounding COVID-19. So again, young people are engaging in unprotected sexual activity throughout the social distancing restrictions and whatnot. So maybe afraid to step forward and get the advice and medical attention that they need to respond to any sexual health issues that are coming up for them at the moment. Again, I've some useful, reliable resources listed here. So the Before You Decide website, spunout.ie, have lots of information on sexually transmitted infections. Youth Work Ireland, again, has a lot of information on sexual health issues. And these are really useful for yourselves and for the young people that you're working with. And what I would advise is that we all check in on these websites every now and again and update our own information around what's out there at the moment. But as I said, these are the more reliable websites that we can go to find out the information. And once we know what the content of them is as well, it makes us more confident in recommending them to young people. So I have another question here, and it's, can you have an STI and not know it? And the answer to which is, yes, you can have an STI and not know it. The fact of the matter is some STIs may not present with any symptoms at all, and we refer to this as asymptomatic. So it doesn't present with any irritation on the skin or any discharge or anything like that. The only way to know for sure that you do or do not have an STI is to seek medical advice and get tested regularly. And most STIs are treatable with antibiotics and or medical creams. As I said, there's the bacterial infections which are treatable with antibiotics. And then you've got the parasitic STIs which are eradicated with medical creams. So you've got, yeah. And so this is a tool that we use within our workshops to explain to young people the social life of STIs and how STIs are transmitted from one person to another. So we've got a little sketch here of a group of people. The question being, how many people did you say you'd slept with? So the girl at the bottom of the screen saying why just the one. So is under the impression that, yeah, she has had sexual contact with one other person, and this would be the partner that she is holding hands with, and this is the only person that she has had sexual contact with. Whereas he has had sexual contact with several other people, and it travels like so. So as you can see, it expands and it expands as things move on. So when we actually travel up the lines and look at how many people that he has slept with, and if she is sleeping with him, then it demonstrates that she has also had sexual contact with all of these people at some point. So even indirectly. Okay, so young people respond to this very well, and they engage in the conversation very well as to how STIs can be spread around. And we also add a game in with this, I suppose pre-COVID times, where young people have a card, one has an X, majority have an O, and the one with the X is representative of an STI, and it's a matter of shaking hands, and those young people then who have shaken that person's hand recognize how STIs are passed on through that contact. So the STI takeaway here is that STIs are non-discriminatory, they're often invisible, and whether suspected or symptomatic can have a detrimental impact on physical, mental, and social and emotional health and overall well-being. Again, mentioning that it's an intricate part of overall health, like physical symptoms of STIs can be very uncomfortable. It can cause irritability, it can cause discomfort, pain, swelling in the genitals, particularly the testes. And then we have long-term tissue damage and infertility if left untreated. So again, we talk to young people about how chlamydia left untreated can affect what's the word I'm looking for? Sorry.
Fertility?
Yeah. I'll come back to it, it'll come to me. But yeah, and how it can also affect the tail of the sperm to cause lazy sperm. Again, mental health, it can cause anguish, depression, anxiety, self-worth issues, self-esteem, and self-depreciation. And the emotional aspects of it are the fear, the loneliness, and the shame that come with harboring an STI and feeling like that you're going to be judged, that you're going to be outcast because you have an STI. Social elements then would be the withdrawal, the isolation, the stigma that's attached to STIs, and fear of judgment as well. Okay, so introducing you into the workshop experience. We're a very sex-positive organisation in that it's not about scare tactics and negative outcomes. Talking with young people about STIs is as much about exploring the positives of sexual health, the pleasure aspect, and the health benefits of healthy relationships, communicating with others, respecting others and ourselves, questioning the origins of our attitudes and behaviours, and having the knowledge and understanding of the risks and the building capacity, confidence and wisdom to reduce harm, and being prepared for crisis and what to do if you do find yourself with an STI, and where you can seek support for that. As I said, here's a snippet of the mental, physical, social and emotional. And I'm going to explain to you how we incorporate these dimensions into our workshops and how we set off the journey through sexual health development. So our approach to sexual health education is underpinned by the theoretical framework of the ISM model of behaviour change. So what this does is this illustrates the importance of working on attitudes and knowledge, which in turn enhance the likelihood of the participant having the self-efficacy and capacity to carry out an action. So having the knowledge and skill to use a condom properly and discuss contraception with your partners. The ISM model is based on a theory and evidence which shows that 3 different contexts exist. So the individual, social and material influences that influence people's behaviours. So focusing on the attitudes of the individuals and challenging the behaviour and beliefs that surround the "it won't happen to me" attitude can change individual, social and material context within which risky sexual behaviours occur, and influence change for generations to come, hopefully. So it's about having the education and the awareness around sexual health being a key component in reducing sexual risk activities. So how does this look in workshops? So it's not just about STIs, it is about role modeling. So all of our workshops begin with a group agreement. This activity draws on core values and establishes shared boundaries, expectations, and limitations to create a safe space. This includes transparency of our limitations and the processes regarding confidentiality and child protection as well. So we will always inform young people that we're obliged to highlight any issues or concerns that we see within workshops as well. So we do discourage personal group disclosures, but we do invite participants to come to us in confidence afterwards with any questions or concerns that they might find themselves worried about, or any topics covered throughout the program that they find themselves concerned about. And it's also an opportunity to model positive regard and respect of existing knowledge and any contributions or inquisitions that they may have. As Mira said a while ago, we might have a few topics of conversation where we get to, ew, that's gross, or that's disgusting and whatnot. But again, it's about having the positive regard and respect for what other people do like. It might not necessarily be for us, and we've got the option to say no. So again, it's about exploring the behaviours and attitudes, standards, and the diversity in a meaningful and respectful way with young people. Another aspect of it is the science behind it. So throughout the STI program, as Mira noted earlier, we use appropriate terminology when referring to body parts, bodily function, and sexual activity. But using clearly labelled diagrams, we aim to make learning about the biological functions of the human body informative and fun. This is also about young people becoming familiar with and knowing their own bodies as they develop in the context of sexual health, in terms of reproductive health and erogenous zones and infection prevention and control with regard to STIs and birth control and accessing medical health services. So again, we've got the experiential. So our workshops are transactional by nature. This is to say that like we meet our groups and individuals where they're at. So we use a range of skills that apply to varied learning styles, such as visual props, discussion, scenarios, reflection, that allow for a shared language, understanding, and learning. We're often asked to talk to young people. And again, as I noted in the previous episode, changing our language from active listening to actual listening, where we're listening to the young person and not just showing that we're listening. But we need to change our language with regards to talking to young people as well. I suppose our attitude when we go into a workshop is that we're very much talking with young people, and they're very much involved in leading the conversation process, and we're there to monitor and control it. But like, we very much take on board what they're saying and what their knowledge base is, and we can come in with an intervention and give them the correct answers and the correct information where necessary as well. And it's a great opportunity for them to express their views and their opinions on what sexual health is and what sexual health should be. And the final factor there is safety. So again, the STI workshop provides practical steps to prevent the transmission of sexually transmitted infections, and the ability to manage birth control, but it also nurtures social factors and the consciousness of core values and healthy relationships, communicating with others, and placing yourself in another's shoes. So being that person who has to tell somebody that they have an STI, or having a conversation with your partner before engaging in sexual activity. And that's to, I suppose, empower young people as well to make that choice of having the conversation before or afterwards. So again, just to give you an idea of what the group agreement consists of. So the young people will contribute to a group agreement. We will also contribute to a group agreement, and it's about having shared boundaries and expectations within a group setting for the duration of the program to make sure that everybody feels safe and everybody feels like that they're being heard and that they've got a part in it. So again, looking at the list here, it's made up of a lot of the core values that we mentioned in the last episode of the series. And it encompasses the principles of sexual health as well. Okay, the labeled diagrams that we talked about, as I say, it's about recognizing bodily function and becoming familiar with the body. So it's about being able to name everything in its right context, and I suppose doing exercises with young people as to what names they put on them and what they call them on the street, which can be a very fun activity as well for our young people, but it also gives us an opportunity to understand the language that they're using at the moment. I have the fallopian tube circled here, which is the word I was looking for a while ago in terms of chlamydia, where it can, if left untreated, break down the tissue in the fallopian tube and cause infertility later on. Again, gives us an opportunity to point out the prostate gland. When we do mention the prostate gland in sexual health workshops, a lot of young people do associate it with prostate cancer, and I suppose it's their main association with the prostate gland. And we also, I suppose, gives us an opportunity to talk about testicles, so testicle checking within the male reproductive system. So again, promoting the lads are taking the opportunity to check their testicles, be familiar with their testicles, and observe any changes that come along later. And it's the same with breast checking when the opportunity arises. So the workshop experience very much gives us the opportunity to talk to young people about the clinical experiences as well. So talking with young people about the processes and expectations of a visit to the STI clinic or GP sexual health visit. I suppose it can be a case of a lot of worry and anxiety for a lot of young people, where they're conceptualizing the waiting room and they're nervous about being in the waiting room and who's going to see them in the waiting room, and are their friends going to see them, are their neighbours going to see them, and what to do if that happens. And again, I suppose we're very much encouraging young people to avail of these services in the sense that they're in the waiting room of the sexual health clinic because they're looking after their sexual health, they're looking after their overall health, and they're accessing medical services and advice to benefit their own health. And again, it's a matter of everybody else being in that room for the exact same reason as well. So whether you're in there because you're worried and you think you might have something, or you know you have something, that is irrelevant. Like the main point of the matter is the fact that you're there and you're looking after yourself and you're looking after your partner's health as well. So again, we talk young people through what can be expected when you go into the sexual health clinic. So it goes from everything from making the phone call to make the appointment, to going in, sitting in the waiting room, and what you can expect with the medical professionals as well. So when you go into the doctor, and you can expect to have a blood test, you can expect to have a swab, you can expect to have a physical overall check as well. And it's about having a conversation with the medical practitioner as well around your sexual activity and your sexual history, and encouraging young people to be open, honest and transparent about what their experiences are so that they can look after themselves in their entirety. Again, a general question that comes up in workshops is, do I need to hold my pee when I go into the sexual health clinic? And the answer for that is yes, because you will be asked to provide a urine sample. And as far as I'm aware at the moment, it's a matter of holding your pee for an hour before you give that sample. It changes and it varies from time to time, and again with COVID-19 the time has reduced from 4 hours to 1 hour in terms of holding your pee before you go in to provide a urine sample. And again, as I said, what tests will be done, and like I said, our workshops are very much experiential. As Mira noted there earlier on, we do the condom demonstration with the groups, and the young people very much get to open the condoms, experience what they feel like, experience what they look like. Some may never have seen them before, and others may have quite a bit of experience with regard to the same. But just to give you an idea, like we have the latex covers and the dental dams, we have the swabs that they can look at and touch and feel and everything like that. So again, it's about giving them a positive sexual health experience during these workshops as well. Just a little bit of medical consent. A young person aged 16 years or over can access and attend medical services independently. It is not an offence for those under the age of 17 to purchase condoms or other contraceptives, even though the age of consent in Ireland is 17. It's a matter of young people looking after their health, so they are entitled to access health services under the age of 17, even if it is to do with sexual health. I suppose, again, in the interest of transparency, any doctor or medical professional will tell a young person who is under the age of 17 and under the age of consent that they may have to inform a parent or a guardian if they're worried or concerned about coercion or unlawful sexual activity under the age of 17, okay? And the TUSLA website has the national consent policy there as well. So there's a lot more information on that with regards to medical consent in young people, okay? So just to round up, so the information that we do provide young people with is centered around safety, so reducing the risk of STIs, practicing safer sex, using condoms correctly every time you have sex, avoid oral sex if your partner, you have sores on your mouth, gums or anus, reduce your number of sex partners, get tested regularly, have a screening with your partner before starting a sexual relationship. If you have an STI, you may be advised to avoid sexual activity during treatment, and wash before, during, and after sexual activity. Hygiene is key. So taking every step and precaution that they can to protect themselves from the risk of STIs. So again, just to recap on the data and resources that I showed you a while ago, the HSE have launched a new campaign as well, Talk, Touch, Make Love with Consent campaign, and there's more information on that on Cork Healthy Cities website. MySexualHealth.ie has a lot of information as well that young people may find useful. And then you have the Gun Clinic and STI Clinic in South Infirmary Victoria Hospital, which also offers services complementary to the services that were mentioned earlier on. Okay. So finally, some take-home messages from today. Younger people, 18 to 25, more likely to experience difficulty in accessing contraception. The main barriers to accessing contraception reported are lack of local access, cost, embarrassment, inconvenience, lack of knowledge about where to access contraceptives. Contraception is expensive. However, with medical card, it's free of charge except for the €2 levy per item at the pharmacy, and some STIs may have no symptoms at all. The only way to know you have an STI is by getting tested regularly. And free condoms and lube are available at the Sexual Health Centre, and the Youth Health Services is a dedicated service for those under 23s with a free contraception and STI clinic as well. Okay. So our next session is on the 10th of November, and this will be around gender and sexuality and talking to young people with regards to the same. Don't forget to sign up. We look forward to it already. It's great to see everybody here today, and I would like to take the time to ask if there's any questions. Mira, has there been any questions on your end?
No questions so far today, but if anybody would like to throw some into the chat box, some lovely compliments coming in, all right, which is great to see. Thank you so much. And if anybody would like to send us a question privately, again, you can send it into education@sexualhealthcentre.com.